Hi, everyone. And it's Christine again, your nurse educator here in Australia. Now, if you're a new grad or an internationally qualified nurse, or you're about to become an Australian registered nurse, this video is especially for you. And today, we're breaking down one of the most important skills you need in any clinical setting. And this is how to properly use and understand the drug register book. Bear in mind, this is just like a basic explanation. And we did put the reference right at the end, so you could look that up as well for more thorough explanation. But yeah, so this is where your medication safety, legal accountability and professional practice all come together. And trust me, mastering this early will make your shifts so much smoother, right? And don't forget to hit or like this video, hit the subscribe button and hit the bell so you'll never miss a lesson whenever I upload informational video for you. And make sure to comment as well if you have any questions at all. Happy to help you. All right. So yeah, so let me explain. The first 3 pages of the drug register of addiction book talks about the policies and procedure that you really need to understand as an RN. So take a bit of time to really read it, right? So let's talk about some basic things that you need to know. At the top, right? So this is where you write the medication name, strength of the S8 or S4 drugs that you need to write down. Bear in mind, you as an RN can write this down, okay? And so again, simple, right? The ward where you're at, this is where you write down. And you particularly be the one to write this, especially if you're receiving medication. And so let's move on, right? A little bit of a basic knowledge or information. In the comment section, this is where you usually, like put any relevant comments if there's any, or also the pharmacists usually, when they destroy the S8 and S4D medication. Yes, in Australia, if we're to dispose or discard an excess medication or expired medication, the pharmacy are the ones to do that, right? And I believe in some countries it's different, but in Australia though, when we're discarding a medication given to the patient, that as an RN we could discard that with another RN. All right, so I hope that's nice and clear. And the footnotes is where you write the details of an error committed, just in case you say, for example, you didn't mean to write a or give that particular medication, so you would need to put an asterisk. We will talk about it later, and this is where you need to put it. So yeah, I hope that's nice and simple. And yeah, so talking about transferring the balance. Now we only transfer if we've already used up all of the page, right? So we've written down every single column. Now it's finished, right? And we have to transfer it to another page. So to transfer that, you would then again write down, the name of the tablet, the word, and then you would write down the transfer balance from page whatever that particular full drug register book is from, right? So you would write that page number. And so obviously you'll carry out the balance, right? And then whoever is the one that's transferring it, they'll be the one who write down in the administering person. Bear in mind, just to highlight to you, whenever we do a signature, it has to be the full signature. It can't be your initial. So I hope that's nice and clear, right? And so, yeah, let's talk about recording the amount of Schedule 8 or 4 medications. Now, for those of you who obviously, doesn't know yet, whenever we record, it's when it's liquid, we're counting by the mils. All right. And so, say for example, there's 100 mils in the bottle. So if the dose ordered, obviously you still have to calculate, right? If the dose is ordered is 10 mils, then we need to put 90 mils. Got that? Okay. So yeah, so that's how we record liquid form. Now, if it's solid, if it's a tablet, we're counting the tablets, right? Yes, you can administer like 5 milligram, but to total it, it's the number of tablets that we are counting. Now, when it comes to ampoules, it's actually the whole ampoule you're counting. So usually 5 in 1 box. So if we take out one and we've only given half of it, that half needed to be discarded. That's the policy in Australia. So yeah, and as again, as I said earlier, right? You can discard that half with another nurse to the sharp bin, right? So we don't need the pharmacy to actually discard that, because I from experience teaching nurses from different country, some policy they have to discard it with another nurse, with the pharmacy rather. So yeah, so I hope that's nice and clear in Australia. Now, when it comes to patches, right? So for example, 1 box, there's 10 patches, you gave one, then that's how you count the balance. And I hope that's nice and clear. Counting the balance is very important, of course, because it's an addictive drugs. This will allow us as nurses to be accountable. Just so you know, the policy in Australia, once a particular tablet, some meals are missing, ampoules or patches is missing, this has to be reported to the nursing unit manager, right? And then the nursing unit manager will then investigate on it as to what happened, where did it go, right? And so if that's the case, then right, if the nursing manager couldn't locate it, a police actually have to be involved on this, right? So that's the seriousness of really having to be accountable for all these medications that we're handling, especially if you're working in Australia. It's very, very strict. So make sure that you guys are, following the policy and procedure. And so, yeah, now when making entries into the ward drug register, so make it simple. So say, for example, we're giving a medication to Santa Claus, right? And yep, so you would usually put the date, the time, right? And then the name of the person, right? And if you've given, say, because endone comes in 5 milligram tablets, right? And so the patient only requires half a tablet. And so we put 0.5, okay? And so to discard, we need to put 0.5, right? So I hope, that's clearer. And because we've given one tablet, we've discarded half, then there will be 15 tablets. So in Australia, we don't keep the half for later, just so everyone know, right? So we have to discard it. Now, again, just to highlight, whenever you guys, obviously this prescriber, you would see that in the medication chart, right? Wherever the doctor prescribed the medication. And so if you're the administering person, so say, for example, I'm looking after this patient, you're going to be the one who will write down here. Now, whoever the checking nurse is, they're the one who will be needing to document here. I hope that's nice and clear. Yeah. So moving on, discarding medications, which we talked about a little bit earlier about this, right? So if you're discarding, again, it's right here, pretty straightforward, right? Again, if you're giving half an ampoule, say for example, right? So you can write down 0.5 as well. Again, that has to be discarded in the sharp bin. Okay, so any unused amount of medication needed to be disposed of in the sharp bin. So just to clarify, we don't really need pharmacy if we're just discarding half of the medications that we're giving. And so moving on, correcting errors. So just for example, you guys have written an error, right? So the red one, just focus on the red one. So say, for example, you didn't mean to write that. You need to put error made. All right. So written in error. So you can also write that down, right? Now, the rule is make sure, make sure you put an asterisk on it. Okay. And remember the footnotes that we are talking about here, right? That's where you write the reason why you know, commit that error. So this is where you do need to write it down. Again, after that, you can just write down the the corrects or the actual person, and how many you were administering. All right. So yeah, that's how we can't really, create an erasure on the drug register book. And so transferring the balance to a new page, I think we've talked about this already, but this is about the first few pages of the drug register book, which is important to highlight to you nurses. So once a page has been transferred, this will allow us nurses to make it easier to know where whatever page we transferred it to, right? So say, for example, it was on the page 11, 12 before, now you transferred it to page 13. This is particularly very helpful. So then we know where we need to open the page. So I hope that, that helps you as well when you start your working in the hospital, right? Making it easier for you to locate the endone instead of like, opening it up, right? Yeah. And yeah, so that's definitely particularly helpful for you as well. That's why I included it in the this basic drug register book explanation. And again, these particular information are available in the New South Wales Health Policy Directive. And that's where I've got this explanation from. Yeah, so I do hope that you've learned nice and simple, as I said, basic drug register book explanation, right? And don't forget to, comment down below if you do have any questions. And AuRNpathway, if you require help with your OSCE preparation, we're happy to help you. All right, bye for now, nurses.